Hello, I want to welcome you all to our town hall today. I want to welcome all of those who are here in person and those who are joining us via live stream. Today is a pretty big day. We have our town hall. The Jets are playing Toronto here. The Blue Jays are playing later today. And later on tonight, we can watch the debate. And I ordered those in order of importance. So, that's a little loud. We're officially more than halfway through our 5-year strategic plan. We started these town hall meetings as a way to keep all staff in the loop about the direction of the organization and to ensure that we are open and transparent about every project and goal. Along the way, in addition to updates, we found that it's a great place to share some of the stories that are a result of your hard work. The current strategic plan has been ambitious and has brought about a lot of change. I know the goals have challenged everyone within our organization to think creatively and differently about the work we do. The strategic plan has brought programs and services together to collaborate on projects that have formed new working relationships that are shifting the way we share information and how we work together. I'm amazed and grateful every day for the work that all of you do and for the dedication and tireless enthusiasm you bring to work every single day. There's a reason that St.Amant has been named top employer again this year, and mainly it lies with the people who form our culture, all of you. So thank you, each and every one of you, for coming along on this journey and bringing our plan and goals to life. The last 2 years of our strategic plan will be filled with many new challenges and opportunities. My hope is that you'll continue to be flexible and engaged in thinking of new and better ways to provide services. To date, we have a lot to be proud of. I've spoken with many of you and visited many team meetings, and I often see a combination of excitement and impatience for what's to come, mixed with some trepidation around what these changes would look like and what they'll mean for your actual work. I recognize that we're all feeling a little bit weary. 5 years is a long time. Robert Crippen, who's an American astronaut, said, "When you work really hard for something for a long time, it's almost impossible to believe that it's coming true." Well, I can tell you, it is coming true. Today, I want to show you that all of your hard work is really paying off. We're meeting our goals and more, and making significant change that directly affects the quality of life of people with developmental disabilities. We compiled a list of accomplishments since the launch of the 2013 strategic plan, and the entire list was more than 2 pages long. Our strategic goals all fall within 4 areas of priority. They are expansion and transition, education, leadership excellence, and communication. I'm going to talk specifically about some of our accomplishments, but first, I'd like us all to watch this video that highlights many of them. That's pretty impressive. That's all the work that you guys are doing. As you can clearly see, we're offering many new services that were identified as great needs in our community. We're also working really hard to deliver services from a person and family-centered perspective through mindful interactions. We've modified our training to ensure that staff have a good understanding of our values and what it really means to work at St.Amant. We're working hard to deliver services to each person as an individual in a way that is meaningful, respectful, and empowering. A great example of this is in the community residential program, where we're moving towards more of a continuum of services rather than one standard model, giving the individual much more autonomy and independence. It's an empowering way to deliver services. I also want to thank all the leaders within the community residential program for their really hard work in managing overtime, working on performance management, and improving our recruitment process over the last few months. Big thank you to all of you who, I think many of you are here today. Another example is in the Autism Program, where our school-age services have changed. We're now able to provide supports for children up to the age of 21 on a consultative basis. We know that not every student needs the same number of hours of support, so spending our budget on students as needs arise until they graduate is a much better use of funds. Additionally, we're supporting our leaders to have the tools to support their teams in a positive way, to use their team members effectively, to live the values, and to help the team to grow and develop their roles. As you know, we have a new Conservative government, and therefore new ministers and staff to get to know and build relationships with. And we're working hard to do that. The Minister of Families, Scott Fielding, has already visited, and I also had a chance to meet with him at the legislature as well. We've invited the Minister of Health to visit us and expect to host him here soon. Some of the things we're addressing with the Minister are the autism wait list. We're still advocating hard on our own and collectively with Abilities Manitoba for higher wages for our direct support professionals. And we're talking to them about how we can deliver innovative services that are better for the individuals we serve as well as for the funder. We developed a video to help introduce our organization to our new funders. So when the Minister was here, this is the video that we showed him. And we thought that it captured the essence and the spirit of the work that we do, and we'd like to share that with you right now. That's a nice feel-good video. One of the people in the video is here today, Jimmy. I know you're here, and I don't know if you've seen that before, but you did an awesome job on there. But I also want to just point out to everybody here that Jimmy just did an awesome job in co-chairing our festival. So big thank you to you, Jimmy. These are interesting times, and certainly new government and new ministers bring the challenge of educating a team of people about our services, and it also brings about some great opportunities for new ways of thinking. On that note, we were very pleased to see that Jay Rogers was appointed as the Deputy Minister of Families, and for those who don't know, the Deputy Minister is the most senior civil servant who reports directly to the Minister. And Jay has lots of government experience and was most recently the CEO of Marymount, one of our sister agencies. He has a really good understanding of St.Amant, and we, all of us, look forward to working with him. On another note, we have a new critical incident stress management support available to all staff. Working in human services can lead to stressful situations. I think we all know that. The Critical Incident Stress Management Support is a short-term helping process to support staff and others in any situation where there may be conflict, a health concern, or any significant stressor in your work environment. We've trained roughly 60 first responders. That's most managers throughout our organization who are available to check in and help diffuse a situation. After a check-in, the manager or the employee may ask for further support through a debriefing. Any manager should be able to help you or to point you in the direction of help in the event of a critical or disturbing incident. If you would like more information, please talk to your manager or to James Ediger, our Director of Outreach, who is overseeing the support. We really take your health seriously. No staff member should be expected to go through critical incidents on their own. I'm really pleased that this support is up and running and available to you all. There's a few significant projects that you may be wondering about. The first is the renovation on the 3rd floor. We've selected the contractor. The building permit is in process, and we're going to start construction just after Christmas. We could likely start before Christmas, but that would mean displacing people just before the holidays, and we want to minimize the disruption on the folks on 3 West who will need to relocate. I feel it's important to let you all know that we know that things are not perfect here at St.Amant. We know that we've made some mistakes along the way, and that there's still a lot of work to do in various areas where the idea on paper is not quite working out the way we thought in reality. We expect that, and to be frank, we know that if we aren't making mistakes, we wouldn't be improving. Trying new things and adjusting along the way is how we all learn. A good example is the integration of the recreation staff on the living units. We know that this hasn't been easy, and it's taking some creativity and flexibility to figure out how to make it work best so that the individuals living on the units are receiving the best possible experiences. I have every confidence that your groups will collaborate together to make the change a success. But I know that it takes time, and it takes trying different plans and then modifying and sometimes trying again. The dedication and energy from the living unit staff is absolutely undeniable, and I have every confidence that the new roles will blend and that the services will be improved. We had a great meeting with the Department of Education about our St.Amant school. We sometimes wonder where our services fit in and if they're valued in the same way that we value them and even welcomed in the larger kind of service system. Our meeting was really positive, and it confirmed that the Department of Education understands the expertise that exists at the St.Amant School and truly values our contribution to the continuum of supports available through all of the school divisions. In fact, they asked us to offer even more consultative services and allow students to come for short-term enrollments within our school. Last, you may have read that we're in the process of reviewing our spiritual care services. We're bringing in lots of external people who have more current experience in how to offer excellent services in this area, and we're also consulting with participants, with families and staff to ensure that we have a well-rounded vision going forward. We know that that vision must include spiritual health for all people, and we expect to have a plan early in the new year. So please keep your eyes out for opportunities to provide your feedback sometime over the next few months. I hope that you're all feeling like you're getting the information that you need about the direction of the organization, and if you're not, I'd like to know. So either through the questions that we have an opportunity to present in a few minutes, or by talking to your manager or director. We want to help everybody have the global view of all the great work that's happening, but we also don't want to overwhelm you or bore you with too much detail. And the video is a good example. Those are strategic, for the most part, outcomes that we have all worked together to produce. But on top of that, and we mentioned it was 2 pages of outcomes that we produced for this, there are probably another 50 pages of things that people are working on in their specific areas that they are proud of and that are moving our services forward. So it is hard to know how much information to present to you here, and we're all sensitive, especially when we're talking about this, around not wanting to leave people out or the important work that they're doing. I have two really quick announcements, and then we're going to get to the interviews. And this is our second town hall where we're going to do live interviews. So today is the last day that you can submit your completed paper copy of the engagement survey. I really hope that you all have had an opportunity to tell us what you think about your work and your environment. This really is the best way to give us feedback. The results are taken very seriously and turned into project plans for improvement in the following year. If you are completing an online survey, you actually have until Halloween, October 31st, to complete. I can't stress enough how important this feedback is for our organization. Last, I want you all to know that I've had my flu shot. I actually just had it about an hour and a half ago. I think that all of the executive has had their flu shot, and I'm counting on each and every one of you to take the time to get your flu shot. It must be somewhere here. So thank you, Cynthia, for that message. That's awesome. If that does not convince you to get a flu shot, I don't know what will. This isn't just about you, and that's kind of what Cynthia's trying to tell you there. This is about your friends and family who may be elderly or have health concerns. This is about the babies and the small children in your life, and as an employee of St.Amant, it's part of your duty, I would say, to make sure that we are providing the best possible services to the people that we support. We are constantly trying to figure out how to be creative to get you to have your flu shot, and I want you to know how far your fellow employees are prepared to go to make sure that you get a flu shot. Mona Lisa has said that if enough people get a flu shot this year, she will dress up in a cowboy outfit, and we will provide pony rides next year when we're giving flu shots. But we have to have a high turnout, right? Okay. You're probably wondering, did she know that you were going to say that, John? So now it's time to move to the interview portion of the town hall. So I'm just going to move over to the desk.